Hello, my name is Cindy Cruikshank. I'm a nurse practitioner specializing in women's health at Primary Healthcare in Marshalltown, Iowa. One of the most common questions that I get from expecting mothers is whether they should receive vaccines. I truly appreciate their concern, and we want all the best for you and your baby, and that is important to get your vaccines when you're pregnant. Women should receive the recommended immunizations when they're expecting because those vaccines will give the baby early protection too. There are a few recommended vaccines for expectant mothers. First, get the pertussis or the whooping cough vaccine. Whooping cough can be a very serious disease for anyone, and it can be life-threatening for the baby. And it's sometimes hard to spot early on because many babies with this disease don't cough. Instead, they just stop breathing and they turn blue. The pertussis vaccine helps the mother generate antibodies that will naturally pass through the placenta to the baby to protect the baby. It's safe and recommended also for you to get the flu and COVID vaccines. These are important because expectant mothers could get seriously ill from the flu or COVID due to changes in your heart, your lungs, and your immune system. If you caught either virus, it could increase the baby's chances of developing serious problems, along with preterm labor and delivery. For the flu vaccine, timing is very important to get every year, and we want to get that done by each October. Finally, there are two other vaccines that should be given postpartum after the baby is born, assuming that the mother is not already immune to them. One is the rubella vaccine to protect against German measles, which is very contagious and can cause fever, sore throat, and rash. And the second is the varicella vaccine to protect against chickenpox. Chickenpox is very contagious and can be serious, even life-threatening. And the itchy, blister-like rash that comes with chickenpox is rather unpleasant. I do hope you know that I want the best possible outcome for you and your baby. There's no doubt in the medical community that this requires the use of recommended vaccines. We know they're safe and effective, and I've always welcomed vaccines for myself. I encourage you to talk with your primary care provider about the immunizations you need. If you don't have a primary care provider, the Marshall County Public Health Department can help. Call 641-844-2799 or find the Public Health Department online at marshallcountyia.gov. Thank you for watching and stay safe.